here is your question. Right, so if you have read and understood, considering it history-taking station, kindly begin.
Definitely. Good morning.
Yeah, good morning, doctor.
Myself, Dr. Jatin. I'm one of the surgical trainees. May I confirm your full name and date of birth, please?
Okay, I'm Smith Tom, 56-year-old.
Hello, Smith. Nice to meet you. So what brings you here in the hospital?
Yes, I was referred by my GP because of I was seeing blood in my pee.
Oh, I'm so sorry to hear about this. It must have been very difficult for you.
Yes, doctor.
Can I ask you some further questions regarding your problem?
Yes, no problem.
Okay. So for how long you were experiencing this blood in your urine?
5 weeks now.
All right. And is there any chance that it could be coming from any other area?
No, I'm sure. It's only when I go to the toilet to pee that blood comes out.
All right. So have you eaten beetroot recently?
No, doctor.
Okay. So when do you notice this blood in the urine? Is it when you just start it, or it is present throughout the urination, or it is towards the end?
Yes, it's present throughout.
All right. Okay. So have you noticed that you passed some clots while passing the urine?
Yes, occasionally. Some small clots.
All right. So is this blood present all the time, or it comes and goes away?
No, it's present all the time since that 5 weeks.
Okay. So you're having a blood in your urine for last 5 weeks, and it's present all the time. Am I right?
Yes, you are right, doctor.
Okay. So do you experience any pain while passing the urine?
No, no pain.
Okay. Any tummy pain or back pain?
No pain. No pain in tummy and back.
Okay. Have you experienced any loss of weight or loss of appetite recently?
Yes, I have weight loss.
How many kilograms and over how many months?
About 10 pounds over the last 2 weeks and 2 months.
Okay. And what about your appetite these days?
I don't feel like eating.
I can see. Okay. So can I ask you some further questions regarding your problem?
Yes, no problem.
Okay. Have you noticed that there is an increase in frequency for going to toilet to pass the urine?
No.
All right. And do you wake in the middle of the night for a couple of times to pass the urine?
Yes, just 2 times.
Okay. So what about the stream of the urine? Is it normal or weak?
No, the stream is good.
Okay. So have you experienced any difficulty with holding the urine before going to the toilet?
No.
Okay. And do you ever experience irrepressible urges to pass the urine?
No, no, not doctor.
All right. So, have you ever experienced any episodes of fever?
No fever.
Okay. Any injury to your groin or tummy?
No, no. But I can also remember that in the last 2 days, occasionally I have pain coming from the loin, just going down towards my balls. I have that, but on the left side, but that's just the last 2 days.
Okay. I'll just note it down.
Okay.
Okay. So, have you ever met GP in the past for any other medical illnesses like diabetes
Yes,
mellitus or hypertension?
yes. I'm hypertensive, and my GP is giving me drugs. He said the blood pressure is well controlled.
Okay. So, do you remember the medicines?
I can't remember now.
All right.
I've seen them.
Okay. So, are you allergic to any medicines?
No,
Okay. Have you undergone any surgeries in the past?
no, I've not done this surgery before.
All right. Can I ask you some personal questions regarding your occupation and your living?
Yeah, right, doctor.
So, what is your occupation?
I'm a factory worker. I work in a factory.
Uh,
A dye
can I ask what type of factory? I mean, can you give me a more detail about that?
Okay, yes, we deal with dyes and chemicals. I'm working there for almost 15 years now.
Okay, can you summarize your history taking now?
Thank you so much. So, Mr. Smith, a 56-year-old male, presented to me with the chief complaints of blood in the urine, which he's experiencing from last 5 weeks, and it is painless. There is no history of any fever, and there is no history of any trauma. There is no history of any lower urinary tract obstruction, like increase in frequency, urgency, and nocturia. But there is a positive history of the patient is working in a factory uh, of a chemical factory, dye factory, for last 50 years, and uh, from above information, my top differential will be bladder
Okay.
cancer.
Was there any history of weight loss,
Yes,
appetite
the-
loss that you
yes,
also
yes,
should
yes,
mention? And
yes.
then
Ma'am.
what are your provisional and differential diagnosis?
So based on my findings, my top differential is bladder cancer. It could be a
Okay.
renal cell carcinoma.
Yes.
It could be a prostate carcinoma, and then it could be an stone in the kidney, bladder, and ureter, or
Okay.
it could be infection or
Right.
trauma or any bleeding disorder.
Can you please tell me what investigations would you ask for?
Yes, first of all, I would like to do abdominal examination along with the distal rectal examination,
Yes.
and then I will go for the lab investigation, which will include routine investigations like CBC, LFTs, KFT, urea electrolyte, and some specific investigations like PSA levels and
Yes.
clotting screen to rule out any bleeding disorder, which
That
will
is
involve BT, CT, PTI, INR,
yes.
and
Cystoscopy and
then
biopsy.
and
Okay.
then
What are the treatment alternatives that you can offer this patient?
first of all, if I considering this patient to be a bladder cancer, first of all, I go for MRI and CT of the abdomen and pelvis for the staging and grading of the tumor and discussion in the MDT. And then we will have a treatment modalities of medical and surgical. In the medical, we will go for the chemotherapy, radiotherapy, and immunotherapy. And surgical options are transrectal resection of bladder tumor and radical cystectomy.
Okay, good. Right. If time would have been enough, how would you have completed your history?
Um, I would have asked more questions about the personal history, like the patient is smoker or alcoholic.
Social history. Okay.
Yes.
Then
And
family
then
history.
family history,
And-
and then ICE, then
Yes.
ideas, concern, and expectation, then
Yes.
systemic review.
Systemic review. So when I requested you to summarize your history, you should have told me, okay, if time would have allowed, I would have completed my history with this, and then you should continue with what you have taken, because you couldn't get to complete your history. So
Okay,
if
ma'am.
you yourself complete what you have missed, it will give you point.
Okay, ma'am.
Right,
Okay.
good.
Thank you so much for that.